Dr. Eisfeld, we've covered a lot of information related to AML care. As a researcher, what other topics are currently top of mind for you in the field of AML? What are you passionate about?
Again, so many parts. I think there are probably three main things that I'd like to name. And I think about it as a little bit outside of the box. Most what we know about AML and why we have become so much better is because we have been studying patients who were treated over the past decades on clinical trials, and very often here in the US or in Europe. But all clinical trials have a bias, and that most of them have been done on patients who are younger than the age of 60, and B, had fewer patients of other races, ethnicities included, and had patients not included that have AML, for example, not only in the bone marrow, but as on extramedullary sites, how we call it. There's up to 10% of their patients. And also very often have not been done on like very old patients where AML is very common. So older patients from other races, ethnicities, or underrepresented minorities, and patients who present with extramedullary disease are currently, in my view, still underserved. And these are exciting areas and opportunities of research and of active clinical practice, because those are the patients we need to include, if it's possible now, to include them in clinical trials. If there are no trials available, then make sure any other additional molecular testing is done to understand them better, and to advance our disease knowledge so that we make sure that we can give the best possible care. I think the most important part is to get the molecular testing and to enroll into clinical trials and into very often biobanking. And why am I saying that? Is because our knowledge from AML comes from patients who donated some tissue so that we could learn, that researchers decades ago could learn about the genes. We know that leukemias differ so much in between patients. So I am worried that we are yet missing out on potentially important genes that need to be discovered and where we could develop drugs for. And this will only be possible if with these additional testings. The second part is to really consider going to a larger treatment and a larger cancer center. And there are support systems in case that can help in here. And the third part is to get involved even as early as possible, even if you're not personally affected, with visa match, with bone marrow transplant, because there's a paucity of donors, of people of color, and that makes it harder for these patients to get a potentially curative treatment in here. We have other options now in bone marrow transplant where one can use only half matching donors and or other availabilities. But again, that doesn't outweigh the bone marrow donor registry that we need to get better at. And there are just so many factors, such a high degree of structural racism that affects people from every corner. And I think we as physicians, as society, and everybody need to acknowledge that, and we have to make sure that we get better to again give every patient the best care and keep the patient in mind and see what's right for them at the right moment.
Where can patients or people who are interested find out about being a donor?
There is the website called Be the Match that one can put in, and this is probably the best way to get first information, and usually at all the cancer sites, and even sometimes there's information at blood donation places, Versity either, or like the American Red Cross. Usually those places have information laid out there as well.